Health is wealth, as we all know. This was echoed at the meeting organized by the civil society working on malaria, immunization and nutrition, ACOMIN. The meeting was held in Ilorin, the Kwara State capital today, and the meeting was geared towards creating awareness for the activities, achievements and challenges of the society. The civil society working on malaria, immunization and nutrition, ACOMIN, Kwara State chapter, has organized a media meeting to review the activities, achievements and challenges of the group to the public. The various CBOs at the event recounted efforts of the group members and successes recorded in diverse communities, some of which are Ayedun, Ilale, Okewo, Odowa, Eleshundudu, Agoja, and many others. The achievements included the renovation of dilapidated health facilities, coordinating community youth together, and advocating the use of community health facilities.
Now getting there, we could see that place is now fenced.
While speaking at the meeting, the ACOMIN State SPO, Mrs. Folake Shoyemi, recounted ways the society worked in line with the theme for 2022 WMD celebrations, which is Advance Equity, Build Resilience and End Malaria.
Kwara State chapter of ACOMIN carried out the following activities to commemorate World Malaria Day. And the first one was the team visited the General Manager, Kwara State Environmental Protection Agency, KWEPA, on cleaning of environment of surroundings by community members to avert breeding of mosquitoes that causes malaria. Also, the team visited the Lorin West community leaders on sensitization about malaria and its effects on the society. And part of what we did was also to discuss with community leaders how they can be involved in our facilities. The project we are doing presently is community-led monitoring, and it's being implemented by ACOMIN with support from the Global Fund and through CRS. On this grant, ACOMIN and its member community-based organizations, CBOs, are working in 8 local governments within Kwara State.
She therefore called for an increase in the budget given out by the government for the malaria cost and also urged the media to sensitize the general public on the malaria menace and ways to be free from it.
Other members of this great organization.
The Executive Secretary, Primary Healthcare Development Agency in Kwara State, Alhaja Munirat Eletu, in her remarks, appreciated the organization for their efforts in the state. She announced that the primary healthcare focuses on immunization, nutrition, and malaria with special emphasis on women and children. She added that the government couldn't do this alone, and this is where the agencies come into play as they have to work hand in hand with the government.
I can't imagine another partner that I would rather be in the same room with, like ACOMIN. Because ACOMIN stands for what primary health care stands for. If we are able to eradicate malaria, by the way, malaria vaccines are now being test-run in 3 countries, Ghana, Malawi. So hopefully, by the time it's also widespread, I'm still going to come back and we have to do it together. By the time we also are able to utilize our vaccines and we have no more 0 dose, I think our partnership will be worthwhile. And by the time we now have children not dying from malnutrition because of our partnership, then I think we will be happy persons. Because working in this sector is not about the money, but about service to humanity. And we're in this together because we have to serve the humanity that we have pledged to serve.
She further proposed community policing of primary health care. She revealed she can't be everywhere, so she asked every stakeholder to strengthen supervision. She further appealed to everyone to join hands together and ensure that there is sanity, accountability, and discipline in primary health care. Alhaja Munirat commended the ACOMIN Society by relating their efforts to that of the World Health Organization. The state coordinator of ACOMIN, Kwara State chapter, Mr. Femi, appreciated the effort of the Governor Abdulrahman Abdulrazak administration in combating malaria in the state. He urged every individual to play their part in ensuring a malaria-free society, as the government cannot do it all.
From the section of this administration, Malam Abdulrahman Abdulrazak have done tremendously well in releasing funds for the malaria unit in Kwara State to the tune of 160 million for us to carry out malaria interventions in all the 16 local governments of the state. And presently, as I speak with you, ACOMIN Kwara State is working in 8 LGA of the state. And basically what we do is what is called community-led monitoring. That is to say, we want to monitor all the malaria commodities that are being supplied by Global Fund to the state.
He also expressed profound gratitude to the Primary Healthcare Development Agency in Kwara State. Mr. Femi further pleaded with well-meaning citizens to help in catering to the community project, stating that there is no community without a well-off individual. Timileyin Okunlola reporting for ANF TV.